First, we never heard of thalassemia, so we didn't know what it was. So that was the main shock. The second, obviously, we're devastated, and also the fact that there's no cure. It's very difficult putting the needle in. It's just, you know, we usually cry every time we do it. Not in front of her anymore, but yeah, it's very difficult. And she cries always.
When we start, the injection, she said, I don't want to have that because I don't like the needle. I said, no, beta, you have to have that because this is your requirement.
So it's all stressful, it's all horrible, it's all hurtful, upsetting. We think about it every day.
It's a needle, and if it was like an injection or something, just put it in and then, like diabetes, just pluck it in and that. I wouldn't mind that every night, but staying like the whole night. And it makes scars and bruises, but when I come in the morning, oh, my tummy's hurting because of that thing.
One of the challenges in thalassemia and in managing thalassemia and control of thalassemia is that the level of awareness in the community is really quite low. And even though this is a common genetic condition, particularly in some specific communities, few people have even heard of thalassemia.
Just wondered if you'd heard of thalassemia?
Not lately. Does it pertain to anything special?
Thalassemia, no, I haven't heard before. Is it catching? No.
Thalassemia, I think, is the one kind of disease which occurs there in the summer. Thalassemia.
Do old age? No.
I don't know.
I've never heard of it.
Young children get it. They do.
Senior, sounds like emphysema.
No idea.
I don't know, some problem with, hypothalamus, something like that?
It's quite close to having anemia.
Thalassemia, no,
No idea. Any idea? Food poisoning?
I have thalassemia. It's beta thalassemia major, and what that means is that I can't produce my red blood cells. So every 4 weeks I have to have a transfusion to replace my red blood cells. What it also means is that I have excess iron in my body, and my body can't get rid of that iron on its own, so I have to have a drug to help my body release that iron.
We've got thalassemia, so every month we have to go to the hospital to get some blood, and then when they give the blood, there's a bit too much iron in it, and then we put Desferal on, and then the Desferal helps get iron out, and the tablets help us get iron out. I've been practicing that. Sometimes when you first go, you can be a little bit scared when you grow up a bit. You can be scared, and when it goes in, you want to jump and cry, but sometimes you just hold on to something really tight.
My name's Nurjahan Farooq. I'm a sickle cell and thalassemia specialist. I work in Tower Hamlets. There's a very large community of Asians in this area. I think there's really poor awareness in England and in other countries where there is thalassemia, for example Bangladesh. I think it's due to lack of education and how much knowledge they have of thalassemia disorder.
Thalassemia is common in many parts of the world, particularly parts of the world that used to be affected by malaria. If you look at a world map, you'll see that the areas of the highest prevalence, where it's most common, starts with the Eastern Mediterranean, so Greece, Cyprus, Turkey, and then across the Middle East, including Palestine, including Syria, Lebanon, Iran, Iraq, and then across into India, Pakistan and Bangladesh, South Asia, Southeast Asia, China, Vietnam, Cambodia, the Philippines, and to some extent also Indonesia. And of course, because people from those parts of the world have immigrated to Northern Europe and to North America, we now see thalassemia in these countries, including our own.
Me and my wife, we didn't actually find out we were carriers until well after we had actually conceived our first child. The time where we actually found out about the problem was when we had our baby. When Khadija was born, there was some standard tests that were done in which revealed that Khadija has got thalassemia major.
I was a carrier, and unfortunately my husband was a carrier. And Fatima was major thalassemia, where you have to go for blood transfusion. But it was difficult because we never knew what thalassemia was.
There is also confusion about how, or lack of understanding about how you get thalassemia, you know, whether it's inherited or whether it's something that you acquire like an infectious disease.
For a baby to be born with thalassemia major like I am, what happens is that both parents will be carriers, and there's a 1 in 4 chance with each pregnancy that the baby born will have thalassemia major. So for example, in my case, my mum was a carrier, my dad was a carrier, but they didn't know about it at the time. And when they were expecting me, I was the major. But in subsequent pregnancies, my sister is just a carrier.
My mum and dad were carriers, and then they had a baby, and that baby was thalassemia. Then they had another baby that was thalassemia. They had another baby that was a carrier, and another baby that was a carrier.
Preconception testing is a good idea. If you look at the Greece Cypriot community, they've been very proactive in knowing their carrier status and having preconception testing, and have virtually eradicated the disease in their community.
In 2007 we decided to get married in Cyprus, as my family originate from there, and when we found out that we needed to have the test done, the thalassemia test done to see whether we were carriers, we had to do this 3 months before, as that is the law, and as thalassemia is prevalent in my family, you know, it was a big relief to find out that myself and Gavin weren't carriers.
So it's really important that young people, before they get married and before they have children, know what their status is. It's just a simple blood test.
Before we got engaged, that's when we decided to have the test on the recommendation of our doctor, and it was a really simple test to have. So it was popping in for sort of 5 minutes. We had a blood test, and then I think I waited like less than a week just to hear back, and it was because I wasn't a carrier. I just got a phone call from my doctor, so it was really sort of a simple procedure, but definitely worth having.
The more important thing is to get tested before you actually get married.
Yeah.
The majority of people in this country find out when they're pregnant. During their booking, they have a blood test done, and that's when they find out, and that's when the husband will be tested. They become quite devastated because, you know, and there's nothing they can really do because they're pregnant. And then the choice they do have is to have prenatal diagnosis, you know, and to find out what the baby is. So it is like quite hard to find out such a late stage. It would be nice to have it done either as part of your registration with GPs when you register, or if you're going to go for contraception, it'll be nice to have it done then.
You should have a test done, yeah. So it works out easier for both couples than, you know, when you know that if you're a carrier or you're not a carrier.
You can get yourself tested, you can get your future prospective partner to be tested as well, so that you know how to go about your life. Then you can have children or not have children.
To get tested is vital.
If you know your status, then you can advise your partner and make the correct decisions. Because at the end of the day, living with a thalassemia child is still a very painful issue, because you have, in a lot of communities, there's a lot of guilt with a thalassemia child being born. There's a lot of guilt with having to, set up treatment, the transfusion, the drips and all the rest of it, and the pain that child will go through and through its life. So I advocate that everybody should get tested.
It's really important that people thinking about having a family actually get the screening done, have that blood test done. If both partners are found to be carriers, they can make an informed choice about whether it's right for them and whether they can support that child and actually treat that child as they would any other child. But it's a personal choice, and for me it's about making an informed choice.